There we go. Thank you. So this is a panel discussion that is from the American Rhinologic Society. We're pleased to be here joining the European Rhinologic Society for this meeting and to be guests here of your society. Can we advance the slide, please? So the participants for this, I'm Richard Orlandi from the University of Utah in the US, and my three guests today are Peter Wong, who is a professor at Stanford University in the United States and a past president of the American Rhinologic Society. Actually, all three of my guests are past presidents of the American Rhinologic Society. I have the pleasure of being the current president. John Delgadio at Emory University, professor there and vice chair, who is also a past president, and Todd Kingdom, who is actually all three are vice chairs, aren't they, at their respective organizations. Dr. Kingdom's a professor at the University of Colorado in the United States as well. So our discussion today is going to be on office-based rhinology. This is an interesting topic for us. In the United States, we're seeing more and more procedures being done in the office, outside of the operating room, outside of theater. And so we're going to be talking about just the basics. Dr. Wong will be taking us through the basics of office-based rhinology, what is necessary to begin and why do it, and so forth. Dr. Delgadio will then talk to us about what can be done in the office. And I will tell you, I'll give you a little inkling. You will be surprised, I think, to see what can be done in the office from Dr. Delgadio's presentation in a patient who's fully awake, no sedation, and what can be done, and really the breadth of rhinology and what we can remove from the operating room and bring it into the office. And then Dr. Kingdom will be critically evaluating this idea, and I think it's a very important thing because should this be done? Just because it can be done, should it be done? What are the different costs, and what are the benefits? In each of our different medical systems around the world, we're going to have a different take on whether this is beneficial or not, from a patient perspective, from a cost perspective, from a societal perspective. Depending on how care is reimbursed, we may or may not actually be driving down the cost of care and being able to provide more services to patients. And so this idea of critically evaluating this will be important. We're going to very much want to have your participation. All of us represent different areas around the world, and we can learn from one another as we have this conversation about, is it beneficial in your environment, in your country, in your health system? And how helpful is that? And so we would appreciate very much your participating in that conversation. So I'll turn the podium over to Professor Wong, who will start out talking about the basics of office-based rhinology. If we could have those Stanford slides now, please.